Hello everyone. Now today we will be discussing about the urinary tract infection, that is UTI. Okay, so UTI can be divided into the upper UTI and the lower UTI. Upper UTI includes your kidney and the ureter, the infection of the kidney, renal parenchyma in the ureter, whereas the lower UTI includes the bladder and the urethra, that is inflammation of the bladder and urethra, which is known as the cystitis. Before going to the cystitis and pyelonephritis, we have to know what is the definition of UTI. Although it will not be asked in the USMLE board, but sometimes it is necessary to understand it. Okay, so organism, urinary tract infection is diagnosed only when the organism present is 10 to the power 5 colony forming unit per ml. What does that mean? That means that 1 lakh of bacteria, that is 10 to 5 power 5 ml of bacteria, that is colony forming unit of bacteria per ml is required for the diagnosis of urinary tract infection. What does that mean? That means that this much of organism should be present in 1 ml of urine to label as UTI. Okay, if this much organism is present in 1 ml of urine, it indicates that the organism is multiplying inside the urinary tract system. That is important. Okay, so this much organism is present, it is multiplying inside it and causing the infection. Less than that, according to the condition, we diagnose the UTI, but less than that is not standardized for diagnosis of UTI. Okay, that should be remembered. Okay, now about pus cell, if we come about the pus cell should be 3 to 5 pus cell per high power field. What does that mean? That means that pus cell should be 3 to 5. If you know about the microscope, there are the 3 lenses, that is 10x, 40x and 100x. 40x is called high power field, and in 40x, if you examine a one field and if you found 3 to 5 pus cell, then that is known as the pyro. That is definition for UTI as well. Okay, so we have known about the definition of UTI. Now comes to the cystitis. Cystitis is we are talking about the lower urinary tract infection, and that is cystitis. Cystitis is inflammation of the urinary bladder. That is simply of cystitis. What does inflammation of the urinary bladder? That is inflammation of the urinary bladder wall. That is cystitis. Okay, how the presentation? What will be the presentation of the patient? The patient will present as suprapubic pain. There will be suprapubic pain with tenderness. If you press, there will be the tenderness, and there will be other features like you will say that he or she will present with that burning micturition, then urgency, frequency, dysuria. These are the complaint symptoms of the patient, and even they will complain about suprapubic pain. When you example, there will be some suprapubic tenderness. Okay. And on urine culture, we'll found on urine routine examination, we'll found this partial, and on culture, we'll identify the condition. Okay. Now, but one major thing is that this systemic sign of like fever, chill, okay, nausea, vomiting are usually absent in cystitis. Okay, if there are systemic sign, that is usually indicates that it is pyelonephritis. So, systemic sign will be usually absent in lower UTI or cystitis. Okay. Now, what are the risk factors? The risk factors include, you know that urinary tract infection is more common in female than in comparison to male, and the reason is that female have short urethra. If you know about the urethra, that is 4 cm in case of female and around 20 cm in case of male. So there will be 4 cm on the urethra. Since 4 cm, it is close proximity. The bacteria, if gives to the urethral opening, then it can ascend into the bladder and cause the infection. And urine itself acts as the cultured media where this organism breathes and leads to the infection. That is important. Okay. Now another point is short urethra. One of the points. Second point is close proximity to the anus. This is urethra and this is anal opening. Now, if you know it clearly that our GI tract, our colon is composed of millions and millions of bacteria. Okay, even 1 gram of stool contains millions of bacteria. And due to the close proximity of this urethral opening with the anal opening in the female, And if the during defecation, the usual wash practice is towards forward, and during forward practice of wash after defecation, the urine stool container of the bacteria over the in the stool get, since there is a close proximity, get easily to the urethral opening and then send up and include to the bladder and cause the infection. This is the ascending infection. So this wash after defecation in the forward direction is one of the important risk factors for UTI. So if a proper hygiene is maintained and wash in the opposite direction, that is the backward direction will be maintained, then obviously there will be the decreased chance of urinary tract infection. So what are the first risk factor is short urethra, second is close proximity to the anus, third is lack of bactericidal prostatic secretion. Then these are the important risk factor. Other risk factor includes indwelling catheter, and then diabetes mellitus. These are presence of indwelling. A single catheterization increases the 7% chance of urinary tract infection. So catheterization is also, indwelling urinary catheter is a very important risk factor. Then diabetes mellitus, impaired, incomplete bladder evacuation. These are the risk factors responsible for even sexual intercourse. If a sexual intercourse, there will be a organism called Staphylococcus saprophyticus. This is responsible for even E. coli, and Staphylococcus saprophyticus is mainly a organism that causes urinary tract infection in young sexually active women, and that is responsible for, that is mainly found in young healthy sexually active female. The urinary tract infection is organism is Staphylococcus saprophyticus. Among that group also E. coli is most common. We'll come to that. Okay, so we have talked about the risk factor. Now comes to the organism. Organism is Escherichia coli. Since Escherichia coli is abundant in our GI tract and our normal flora is responsible for our urinary tract infection, so E. coli is the most common organism. If you remember any just one organism to cause UTI, then you have to remember the Escherichia coli. Okay, then there are other like Staphylococcus saprophyticus, Klebsiella, Proteus, even other are there like Enterococcus, Staph aureus, even other gut organisms are responsible for causing the UTI, but the most common is E. coli. In this, Staphylococcus saprophyticus has been found in young, healthy, sexually active female, okay, to cause the UTI. But in that group also, E. coli is most common. This is the second most common in that scenario. You will have a scenario like a young active female came with the symptoms of urinary tract infection, and they may ask you about the Staphylococcus saprophyticus. Okay, even if you remember in the previous lecture, this is Staphylococcus saprophyticus, Klebsiella and Proteus, they all are the urease positive organism and they are responsible for ammonium magnesium sulfate storm. That is when we have discussed about kidney stones, where we can correlate that. Okay, now if we do the lab finding, there are some dipstick test. In a one stick there will be a certain lot of things are checked, like glucose, uric acid, that bilirubin, all diabetic, ketone acidosis, lot of things can be checked. Okay, in that there is another parameter called leukocyte disturbance, and leukocyte disturbance is name indicates leukocyte. Leukocyte indicates that WBC pus cell, and pus cell enzyme, if it is present, that indicates that there is a pus cell in your urine, and by which you will understand, okay, pus cell is there, it means that there will be the infection. This is the indicator of your urinary tract infection. Okay, even nitrates, usually if you remember that organism, this all enterobacteriaceae organism are responsible for breakdown of nitrates into nitrite. Nitrates are normally found in your urine, and if this organism are present, then they will break down that nitrate and convert into nitrite, 8 into ites. And if you found this nitrites, that indicates that the organism is present and mainly gram-negative enterobacteriaceae. So this will also indicate that there is an infection. Okay, and if we examine under the microscope, we will find the pus cell. If you culture the organism, we will find the 10 to the 5 colony-forming urine organism, and UTI will be diagnosed. Okay, so we have talked about this also. Lab finding, obviously treatment will be antibiotics according to the organism sensitivity, and even empirical antibiotic can be given. Now come to the pyelonephritis. Pyelonephritis is upper UTI, upper urinary tract infection, and that includes acute and chronic pyelonephritis. In acute pyelonephritis, there is neutrophilic infiltrate renal interstitium. That is, pus cell has into the renal parenchyma. That is, acute pyelonephritis is the inflammation of the renal parenchyma. But the important thing is that there will be involvement of the cortex only. So this cortex will be involved. Okay, and if you remember, you have, they will actually escape down this glomerulus. The glomerulus and the vessels, this will be escaped down, but other parts will be involved. And that means that I am talking about the cables, vertical, other structures will be involved. Okay, so this is the inflammation of the lung parenchyma, and the involvement is the cortex. There usually blood vessel and glomerulus are not involved, that I am going to say. Okay, now what will be the presentation? Since it is the systemic infection, now you have having this pyelonephritis. The common cause will be ascending UTI, this cystitis. This organism suppose have been ascend through the urethra into bladder, and bladder through the urethra to the kidney. That will be ascending UTI. Then there will be the hematogenous spread. In hematogenous spread, come from the blood into the kidney. This will be the major two way of spread of infection to the kidney. Okay, now presentation, since presentation will be systemic symptoms more. Okay, then patient will present with high fever, chill, rigor will be there, mainly chills will be there, then there will be the flank pain, okay, nausea, vomiting, this will be the feature. And if you know the renal angle, postovertebral angle, there will be the renal angle tenderness. Okay, so renal angle tenderness will be the finding what we will get. That is a sign. But patient will present with fever, with chills, with nausea, vomiting, and flank pain. Okay. Now, again, the risk factor in this patient will be like there will be a indwelling urinary catheter is there. Then that is a very important risk factor. I have already discussed that one urinary catheterization increases the 7% chance of UTI. Okay. Then urinary tract obstruction. If there is obstruction, then that will precipitate the infection. Then vesico-urethral reflux, the bladder and the ureter, if there is a reflux, then urinary reflux goes back to the kidney. So vesico-urethral reflux is also an important risk factor to cause acute pyelonephritis. Then diabetes mellitus and pregnancy. Pregnancy, cystitis is also common, but pyelonephritis will occur with pregnancy. Okay, so we have understood as a risk factor. Now come to the treatment. Treatment will be antibiotic, and the common organism are these only. Okay. So E. coli, mainly the E. coli, Escherichia coli. It may be the Staphylococcus aureus, other Enterobacteriaceae like Klebsiella and Proteus mirabilis. Okay. So, and antibiotics will be according to the culture sensitivity. Even we can give the empirical antibiotic as well. So we have complication of pyelonephritis. What are the complications of pyelonephritis? Pyelonephritis complication will be chronic pyelonephritis. Then there may be necrosis of the renal papillary necrosis. Then perinephric abscesses, or even leads to the urosepsis. Okay, so urosepsis is also important. Patient may present with your urinary tract infection and in sepsis. Okay, so that is due to the organism that present in urinary tract and has been found in the blood as well. Okay, so urinary tract infection along with the bloodstream infection, that is sepsis. Okay, which is known as the urosepsis. So that will be the complication of your pyelonephritis. You have to diagnose clearly, because pyelonephritis is a very simple diagnosis. Patient with systemic symptoms like fever, chills, nausea, vomiting, flank pain, okay, renal angle tenderness, and on examination, we are not talking about the urine culture, organism will be positive. And when we examine the urine under the microscope, then there will be plenty of pus cell, plus there will be the WBC cast. If you remember about the cast which we have discussed, then there I have talked about hyaline cast, granular cast, then waxy cast, okay, WC cast, RBC cast. This WBC cast, because there is inflammation and pus cell in the renal parenchyma, and that is going to deposit into your cast, that hyaline cast formed by the TAM Harsfall protein, if you remember. Then they will get deposited and form the WC cast. If you do the Uworld, then there is a position related to this cast. Means a patient with all the symptoms of the acute pyelonephritis, they will give you a scenario and like high fever, this chill, okay, nausea, vomiting, flank pain, pus cell is there, organism is positive. organism positive, okay, then we have to confirm this one positive. What are the further finding you will find in this patient, and they will give you option and they will give you a cast. Okay, RBC cast, WBC cast, and the answer will be WBC cast. So you need to understand that. Okay, in USMLE questions, patient in reality, if we look sensitivity depends, urine examination sensitivity depends upon who is examined. If he is an expert, we will find out. If he has read the urinary concentration, then he will find out. But he may miss in the real life. Okay, but in the USMLE board, they will not miss. They will mention about the WB cast, either mention or they will ask about it. Okay, so we have done with the pyelonephritis. Treatment is antibiotics, systemic antibiotics we'll start with the penicillin. Okay. Now comes to the chronic pyelonephritis, and chronic pyelonephritis is recurrent acute pyelonephritis, and acute pyelonephritis is recurrent. Why will occur? Because there will be the risk factor like urinary tract obstruction due to if there is a stone, okay, or there is a vesico-ureteral reflux. That's will the main two major factor that will leads to repeated acute pyelonephritis, and which will further progress to chronic pyelonephritis. What are the findings in the chronic pyelonephritis? You will find the coarse, asymmetric, corticomedullary scarring and blunted calyx. Okay, even if you examine the tubule, in the tubule you will find the cast, and that is eosinophilic cast, which is the shape of the thyroid, and that is known as the thyroid tissue, and that is known as the thyroidization of the kidney. So you should remember this. In chronic pyelonephritis, you will find the eosinophilic cast in the shape of the thyroid tissue, which is known as the thyroidization of the kidney. Okay, that is the kind of chronic pyelonephritis. Then in further, if you treatment will be same. The antibiotics will be the first and removal of your risk factor. That's true. If there is a stone, then you need to surgically remove of the stone is also necessary. Okay. Now the important thing is there is another term called xanthogranulomatous pyelonephritis. Xanthogranulomatous pyelonephritis. Xanthogranulomatous pyelonephritis. It indicates that a patient may present with the orange nodule and that resemble the tumor, renal tumor, but it is not a renal tumor, it is an orange nodule, and that causes the damage of the kidney. Okay, due to the granulomatous tissue present a foamy macrophage. So granulomatous tissue of the foamy macrophage will be responsible for damage of your kidney, and that is known as the xanthogranulomatous pyelonephritis. If you examine, then you will find a orange nodule. It's resembled to the tumor, but it is not. So you have understood the cystitis, pyelonephritis, acute and chronic, and you will have a question. It is an easy topic, and it is easy to diagnose, easy to get this score this match this question, answer this question, and score the board. Okay. So hope this is helpful. Thank you.